How do cigarettes affect the body? Cigarettes aren't good for us. Let's how they knew. We knew about the dangers of smoking for decades, but how exactly do cigarettes harm us? Let's look at what happens as their ingredients make its way through our bodies and how we damage physically when we finally give up smoking. With its inhalation, smoke brings more than 5,000 chemical substances into contact with the body tissues. From a start, tar, a black resinous material, begins to coat the teeth and gums, damaging tooth enamel and then eventually cause the decay. Over time, smoke also damages nerve endings in the nose, causing loss of smell. Inside the airway and lungs, smoke increases the likelihood of infections as well as chronic disease like bronchitis and emphysema. It does this by damaging the cilia, tiny hair-like structure whose job it is to keep the airways clean, and then fill the alveoli. Tiny sacs that enable to exchange oxygen and carbon dioxide between the lungs and blood. The toxic gas called carbon monoxide crosses the membrane into the blood, binding to hemoglobin and displacing the oxygen it usually has transported around the body. That's one of the reasons smoking can lead to oxygen deprivation and short of breath. Within about 10 seconds, the bloodstream carries a stimulant called nicotine to the brain, triggering the release of dopamine and other neurotransmitters including dopamine, the greatest pleasurable sensation which makes smoking highly addictive. Nicotine and other chemicals from the cigarette simultaneously cause the construction of vessels and damage their delicate insular lining. Is restricting blood flow. These vascular effects lead to things as a blood vessel wall and harm blood vessel thickness, increase the likelihood that cause withdrawal and trigger heart attack and stroke. Many of the chemicals inside cigarettes can trigger dangerous mutations in the body's DNA that make cancers form. Additionally, ingredients like arsenic and nicotine may disrupt the process of DNA repair, the strong ability to fight many cancers. In fact, about 1 of the 3 cancer cases in the United States is caused by smoking, and it's not just the lung cancer. Smoking can cause the multiple tissue and organ, as well as damage eyesight and weaken bone. It makes it harder for women to get pregnant, and men, it can cause erectile dysfunction. For those who quit smoking has a huge positive upside with almost immediate and long-lasting physical benefits. Just 20 minutes after a smoker's final signal, that heart rate and blood pressure began to return to normal. After 12 hours, carbon monoxide levels stabilized, increased the blood's oxygen carrying capacity. A day after ceasing, a heart attack risk began to decrease as the blood pressure and heart rate normalized. After 2 days, the nerve ending responsible for smell and taste started to recover. Lung began healthier after about 1 month, less coughing and shortness of breath. The delicate hair-like cilia in the airway and lungs start recovery within a week and restored after 9 months, improving resistance to infection. By the 1-year anniversary of quitting, heart disease risk plummets to half as the blood vessel function improves. 5 years in, the chance of clot forming dramatically declined, and the risk of stroke continues to reduce. After 10 years, the chances of developing fetal lung cancer go down by 15%, probably because of a bypass repair DNA is once again restored. 15 years in, the likelihood of developing coronary heart disease is essentially the same as the death of non-smoker. There is no point pretending this is all is to achieve. Quitting can lead to anxiety and depression resulting from nicotine withdrawal. But fortunately, such effects is usually temporary, but quitting is getting easier thanks to a growing arsenal of tools. Nicotine replacement therapy through gum, skin patches, lozenges, and sprays may help wean the smoker off cigarette. They work by stimulating nicotine receptor in the brain, and thus preventing withdrawal symptoms without of these other harmful chemicals. Counseling and support groups, cognitive behavioral therapy, and moderate intensive exercise also help smokers stay cigarette-free. That's good news, since quitting could win your body on the path back to the health. Want more? Cigarettes aren't good for us. That's hard news. We know about dangers of smoking for decades, but how exactly do cigarettes harm us? Let's look at what happens as their ingredients make its way through our bodies and how we benefit physically when we finally give up smoking. With each inhalation, smoke brings more than 5,000 chemical substances into contact with the body tissues. From a start, tar, a black resinous material, begins to cause the teeth and gums, damaging tooth enamel and eventually causing decay. Over time, smoke also damages nerve endings in the nose, causing loss of smell. Inside the airway and lungs, smoke increases the likelihood of infection as well as chronic disease like bronchitis and emphysema. It doesn't despite damaging the cilia, tiny hair-like structure whose job it is to keep the airway clean. And then fill the alveoli, tiny acids that enable the exchange of oxygen and carbon dioxide between the lung and blood, a toxic gas called carbon monoxide across the membrane into the blood, binding to hemoglobin and displacing the oxygen it usually have transported around the body. That's one of the reasons smoking can lead to oxygen deprivation and short of breath. Within about 10 seconds, the bloodstream carries a stimulant called nicotine to the brain, triggering the release of dopamine and the other neurotransmitters including endorphins that create a pleasure sensation which makes smoking highly addictive. Nicotine and other chemicals from the cigarette simultaneously cause constriction of blood vessels and damage their delicate indeli lining, restricting blood flow. These vascular effects lead to thin the blood vessel well and enhance the blood splitting sickness, increasing the likelihood that cause the will and trigger heart attack and stroke. Many of the chemicals inside the cigarettes can trigger the dangerous mutations in the body's DNA that make cancers form. Additionally, ingredients like arsenic and nickel may disrupt the process of DNA repair that compromise body's ability to fight many cancers. In fact, about 1 of 3 cancer deaths in the United States is caused by smoking. And it's not just lung cancer. Smoking can cause the cancer in multiple tissues and organs, as well as damage the eyesight, weaken bone. It makes it harder for women to get pregnant, and men, it can cause erectile dysfunction. But both just quit smoking, there's huge positive upside with almost immediate or long-lasting physical benefits. Just 20 minutes after a smoker finds a cigarette, the heart rate and the blood pressure begin to return to normal. After 12 hours, carbon monoxide levels stabilize, increasing the blood's oxygen carrying capacity. A day after ceasing, a heart attack risk began to decrease as the blood pressure and heart rate normalized. After 2 days, the nerve ending responsible for smell and taste started to recover. Lung began to healthier after about 1 month, a less coughing and shortness of breath. A delicate hair-like cilia in the airway and lungs start recovering within weeks and restore after 9 months, improving resistance to infection. With the 1-year anniversary of quitting, heart disease risk plummeted to half, and the blood vessel function improved. 5 years in, the chance of clot forming dramatically declined, and the risk of stroke continues to reduce. After 10 years, the chance of developing fetal lung cancer goes down by 15%, probably because the body's ability to repair DNA is once again restored. 15 years in, the likelihood of developing coronary heart disease is essentially the same as the one of non-smoker. There's no point pretending this is all is to achieve. Quitting can lead to anxiety and depression, resulting from nicotine withdrawal. But fortunately, such effects are usually temporary, and quitting is getting easier thanks to a growing arsenal of tools. Nicotine replacement therapy through gum, skin patches, lozenges, and spray may help with the smoker of cigarettes. They work by stimulating nicotine receptor in the brain and are suppressing withdrawal symptoms without the addition of harmful chemicals. Counseling and support groups, cognitive behavior, and moderate intensive exercise also help smokers stay cigarette-free. That's good news, since quitting puts you and your body on the path back to the health.